Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, would like to welcome you all in my Ayurveda Academy YouTube channel. You know that we have started the series that is Ayurveda in GP, that is Ayurveda in General Medical Practice. Today, we are going to discuss about the hematemesis. Hematemesis means blood through the vomiting. As you know, the vomiting is very common, but when the blood is coming through the vomit, then the people get shocked and they get a very panic and run to the doctor. That's true because it is something little bit more serious than the simple vomiting. So bleeding through the vomiting, it's something having some serious element. We have to see the causes and then we are going to see some investigations and also the treatment. As you know, myself is Professor Deshpande is MD in Ayurvedic medicine and MD in Ayurvedic physiology. So for paid online consultation, we have the expert team of the doctors. You can definitely WhatsApp me on 92268 10630. The number is given in the description. Now, before starting the specific causes from the modern medicine, let us understand some background from Ayurveda. Hematemesis is Rakta Chardi in Ayurveda. So Rakta is a blood. So this is basically the problem of blood. But why that blood get disturbing? Because there is a relation with the Pitta dosha. And according to Ayurveda, we have the Vata, Pitta, Kapha. These are the bioenergies. And amongst these, Pitta is supposed to take care of the digestion and metabolism. But when, because of our faulty lifestyle and faulty food habits, the Pitta Prakop takes place and that attacks on the Rakta Dhatu and the Rakta Pitta Vyadhi is created. So hematemesis is a part and parcel of the Rakta Pitta disease, that is a bleeding disorders. Urdhvaga Rakta Pitta. There are three types: Urdhvaga, Adhoga, and Tiryak Rakta Pitta. And the Charakastu Chikitsite. Charak is the best text to guide you the principles of treatment. And Charak has mentioned that how to treat the Rakta Pitta, Pratimargam cha Haranam. Rakta Pittam Vidhiyate. Pratimarga. That means if the bleeding is from the upward track, we have to give the Virechana Chikitsa. If the bleeding is through the lower passages like urinary or the perrectal, then one has to give the vomiting, rather Vamana Chikitsa. So this is Pratimargam Chaharanam. But basically, you must understand that these hematemesis like cases, we have to treat the whatever the basic root cause, but simultaneously we should avoid the Pitta Prakopak Ahar and Vihar, that is Pitta Prakopak vitiating, which will vitiate the Pitta dosh like food and the lifestyle. Simple things I will explain. All the bleeding disorders you should avoid very spicy, very pungent, chili foodstuffs, and also the sour and salty taste in too much quantity is not good. Also, the things that are having the hot potency, for example, excessive tea, excessive coffee, drinking the alcohol, smoking, these vices or the habits, these are very, very bad for these bleeding problems. And also, not only the food, but your lifestyle. If you are working in the hot sun, try to get protection from the hot sun. Also, if you are working near the hot atmosphere for your profession, for your business, like working in the chemical factories, working in the glass factories, then these particular people should take some rasayana to prevent the provocation of Ushna and Tikshna property of Pitta dosha. I think even not nevertheless, but keeping late at night, going to the sleep for midnight, or increasing the screen time, looking towards the mobile for a long time, or television, or playing the games on the mobile and the use of laptop for the whole day, that also creates the heat in your body. You will not understand that, and that's supposed to be controlled in these problems of Rakta Pitta, bleeding disorders like hemoptysis, hematemesis, hematuria, rectal bleeding. In all these conditions, you have to take precaution. So now let us talk about the etiological factors that are the causes. Peptic ulcer group, for example, duodenal ulcer and the peptic ulcer. Gastric ulcer is identified when there is a vomiting immediately after the food. But duodenal ulcer pain always have 4 hours after the food. It is also called as a midnight pain. And basically, whenever there is an ulcer, there is a difference in acidity and ulcer. Ulcers is the damage to the mucous membrane. And there is a called as a pinpointed sign. Patient will tell you, doctor, here, I am telling the epigastric region, he will by his finger will touch his abdomen and say, doctor, here I am getting the pain, and also the burning in the chest and vomiting. But if he's pointing, this is called as a pointing sign, is very specific for ulcer. Don't forget that. Okay. Then erosive gastritis, ingestion of the medicines, like for example, modern medicines like aspirin, then the steroids, lot of steroids, prednisolone, visolon tablets, phenylbutazone, that is ibuprofen, and all these analgesics, anti-inflammatories, chronic gastric ulcer, hiatus hernia, post-operative group, and previous partial gastrectomy. These causes are there for getting the bleed to the vomiting. Then the most serious cause is a cancer of stomach, that is carcinoma of the stomach. Then portal hypertension, chronic gastritis, other causes, very rare causes, but which are not related with your stomach or which are not related with acidity. You should take care of the hypertension, then especially malignant hypertension, the diastolic blood pressure more than 120 mm of Hg. Normally, 120 by 80. 120 is a systolic blood pressure, 80 is a diastolic blood pressure. But when we talk about hypertension, always check the diastolic, give the importance to the diastolic. Remember my words. Normally it should be 80. Mild 90 mm of Hg, mild hypertension. 100, moderate hypertension. Always above one, lower figure, diastolic. About 120 mm of Hg, oh my God, very serious. Then uremia is a problem with the kidney. Urea is a main waste product which is passed to the urine. But when there is a kidney problem and that urea is not passed, then it is saturated in the blood, and that condition is called as uremia. But this is because of the kidney problem. Then blood diseases like hemophilia, leukemia is a blood cancer, purpura like the capillary bleeding and the red spots on your skin, polycythemia rubra vera, neurological diseases like cerebrovascular accidents, like the brain hemorrhage, especially thrombosis, embolism. This is called as cerebrovascular accidents related with the brain. Collagen diseases rare, polyarteritis nodosa, simple or malignant tumors of the alimentary tract, adenoma or lymphosarcoma. Pancreatic or ampullary, again carcinoma, cancers, alimentary tract diverticuli, local vascular lesions like atherosclerosis or aneurysms. Then anticoagulant drugs, if the patient is put on the anticoagulant after heart attack, especially, always aspirin is given. So you have to check when there is a hematemesis, stop aspirin. Okay. Esophageal tear due to the strain of vomiting. Then miscellaneous causes like atomatic without any reason, spurious due to the blood swallowed after the hemoptysis or epistaxis after trauma to the abdomen or following the burns, erosions of the duodenum, or duodenum by the gallstones. Okay. Now, what you can do, we can do the barium meal X-ray of the abdomen to rule out the peptic ulcer. We can also must do the sonography to rule out any tumor in the GI tract. Then hemogram, peripheral blood smear to rule out the leukemia, blood cancer. Always check the blood. Then abdominal ultrasonography to rule out the abdominal pathology. I have already explained, like tumors. Blood urea to rule out the uremia. Blood urea should be less than 40 milligram per cent. Then BTCT, that is bleeding time and clotting time. Normal bleeding time 0 to 5 minutes, clotting time maximum 10 minutes, 5 to 10 minutes. Okay. Treatment for the hematemesis, rakta chardi, few drops of blood with the bouts of the vomiting are possible. In such cases, treat for vomiting first. So you can give the Shankha Basma 100 milligram 3 to 4 times, especially when there is indigestion. Simultaneously, if it is indigestion, give the Shankha Basma. If profuse bleeding, try to find out the cause and treat basic cause. Mostly found duodenal ulcers, aspirin gastritis or alcohol gastritis, and cirrhosis of the liver in alcoholic patient. Most of the patients may need the blood transfusion, admission in the hospital. Always check the pulse and BP. If necessary, refer the patient to the hospital. Meantime, you can give the symptomatic treatment. Pravala Bhasma, very cool drug, that is cooling the Pitta dosha. Ushna Tikshna property of the Pitta is reduced by using the coral Bhasma, that is Pravala Bhasma, 500 milligram. Make the trituration together, Kamaduda, 500 milligram 3 times in a day. Shatavari Kalpa, asparagus racemosus, sugar granules are there, 4 teaspoon 2 times in a day with milk. This is also anti-pitta. Pitta Ghna Chikitsa, anti-pitta treatment should be given. Chandrakalaras 100 milligram plus Laksha Churna 100 milligram, Pravala Bhasma 100 milligram, Amalaki Churna 500 milligram 3 times in a day with Vasa Valeha. Vasa is the best plant for the Rakta Pitta Vyadhi, especially from the upward tract. Vasa Adatoda Vasica. And there is jam is available, which is called as the Vasa Valeha. Then Himalaya company has the best tablet for stopping the blood, that is Stiplon tablet is available. You can Himalaya company 3 tablets 3 times in a day. So my dear friend, this is all for the short discussion about the hematemesis, but it is a very important disease in the general practice because the patients are always restless, relatives and the parents are very restless. So please assure them first that nothing will happen. I am there. Don't take tension. We will try to find out the cause and we will give the most possible best results. Okay. So in this series, you have to check all the videos. I wish all the best. Please don't forget to subscribe my YouTube channel and press the bell button icon to get the notification. Thank you very much. Take care and see you soon.